CBT is one of the most effective kinds of therapy out there. The basic premise of CBT is that it helps people identify negative thinking patterns and belief systems and replace them with more realistic and possible answers and outcomes. For instance, someone may have been bitten by a dog as a child, so they have a irrational fear of dogs, and they think that all dogs are very vicious. Cognitive behavioral therapists would help this person um, reframe that and start to question that absolute black and white thinking. For instance, like, are all dogs mean? And, maybe try and introduce them to like a different experience, like, you know, going to a shelter and meeting like a nicer dog. Especially in addiction and depression, a lot of our thinking can um, be very out of touch with reality, and we can tend to catastrophize or overreact and exaggerate situations. So a cognitive behavioral therapist is trying to get a client to question their own beliefs and have a more accurate view of reality. So this article on cognitive behavioral therapy, the empirical status of cognitive behavioral therapy, or review of meta-analysis, um, Butler et al. Essentially, it was a meta-analysis. So this means it was a review of multiple studies. Um, it went over 16 different studies and many different disorders. Um, these meta-analyses tend to be a lot more accurate because um, they review multiple studies, so they have a lot more data to analyze. Um, Quoting from the article, the final sample comprised 60 meta-analyses, including collectively 9,905 subjects and 332 studies. Um, it included 562 comparisons covering 16 disorders or populations, including adult depression, um, anxiety disorder, panic, agoraphobia, social phobia, schizophrenia, and a few other disorders. Um, so this is like a pretty wide review of cognitive behavioral therapy, really taking into account um, a lot of different demographics, backgrounds, and um, testing it again, looking at how effective cognitive behavioral therapy is against different disorders. So it's a pretty well-rounded study. So their findings were um, that overall they found that the cognitive behavioral therapy had a lot of evidence to suggest that it was really effective for a lot of disorders. For instance, it says in the article, large effect sizes were found, so that means that it was effective uh, for CBT with depression, general anxiety disorder, panic disorder, post-traumatic stress, childhood depression, and anxiety disorders. It goes on to list a couple different disorders. It also says that CBT was a little bit better than antidepressants in the treatment of adult depression, which I thought was really cool. So yeah, essentially, it's finding like there's actually like a pretty good amount of evidence to suggest that cognitive behavioral therapy is very effective with a multitude of disorders and populations. A couple of caveats is that um, there was some debate about the effectiveness of cognitive behavioral therapy when treatment stops. And a lot of people tend to think that a lot of most therapy treatments tend to stop being effective after a certain point after they're discontinued. But this study actually went on to argue that CBT did have long-lasting effects because it was focused on modifying thinking and behaviors and gave a lot of people a lot of skills they could use in everyday life. So that means like even if you stop seeing your therapist, you'll already have developed a lot of skills that will continue to benefit you in the future. Um, Another kind of limitation to the meta-analysis that they self-reported in this study were that there's like a huge, they called it therapeutic alliance. So essentially that the researchers have some sort of bias against cognitive behavioral therapy. So they were that, kind of put a little bit of doubt of like, how much bias are these researchers bringing to their studies? They found that it did have effect, but even when they waited for that, it seems like cognitive behavioral therapy was very effective. Um, so yeah, overall, I'm personally like a pretty huge fan of cognitive behavioral therapy. We use that a lot in my work, and I think it just gives people like a really solid, useful skills to just combat different disorders and things they're going through.